Virtual office hours. Oh, do you want me to restart? Welcome to the March virtual office hours, everybody. We're really excited today to have Sarah Barton here from Coplin Health Systems for National Nutrition Month. Sarah is passionate about rural health and is an avid promoter of healthy habits. Through her work with Coplin Health Systems, she promotes healthy eating, movement, and behavioral health. Some of her projects include a pharmacy program, a healthy choices program, exercise parks, an employee wellness program, and self-monitored blood pressure programs. She believes that collaboration is the best way for West Virginia to succeed at improving health and incorporates partners into projects wherever possible. So we're really happy to have her here today, and I will go ahead and pass it over to you, Sarah.
Hello, can you hear me?
Mm-hmm.
All right, great. I'm having computer issues today, so it's like every presenter's worst nightmare. So I'm on my phone, I'm on my computer, we're all over the place. So, but I'm excited to be here. I thank you guys for inviting me to present. I am the senior project manager, so I work with a variety of programs. I'm going to talk about and highlight the two that I worked with Marshall, but then I also just wanted to talk a little bit about some of the other programs that we have. I have found actually in my work that offering great programs doesn't always cost a lot of money. There are often some expenses related to.
We also have that if you're interested.
Yeah, there are some expenses related to projects, but sometimes it's just a great idea that people get behind together. And so that's kind of where I come from. So I'm going to talk about our patient support programs. And when I think about patient support programs, it's focusing on positive change and working with people where they're at. You know, we often talk about non-compliant patients in healthcare systems, and it's very discouraging for providers. But when we break it down, getting healthy is a lot of work. And if you are trying to get healthy, you have to figure out where to start. And so patients often aren't on board with everything all at once because it just isn't doable. And so I always, try to remind everyone that we want to provide support as they make life changes. And we understand that change is hard and it takes time. Practice makes progress, and progress is always positive. And so if you've ever been on my emails or talked to me much, I will frequently say practice makes progress, and every healthy choice matters. Because even if I only make one healthy choice today, I have practiced making a healthy choice today. And so, sometimes it's just practicing healthy choices, and then maybe tomorrow I'll be able to make 2 healthy choices. And that may just mean drinking water twice instead of not at all. So, okay, next slide. So when I think about our why from Coplin Health Systems point of view, these programs help engage patients in their health and the health outcomes. It reduces barriers because we do provide access to several things through our programs. We provide access to food. We provide access to education. I'm so sorry. Hold on, let me tell my children to close the door. The dog is the one unpredictable thing. My children, they'll stay quiet, but I can't predict the dog. So long-term impacts are more significant when they're engaged in active programs. So we all know that, when we're actively engaged in a program, we're usually doing pretty well while we're in the program. And so being able to offer programs ongoing is really important. And then when a provider supports a program, patients have a greater belief that it's meaningful. And so engaging our healthcare staff and helping them understand their role in patient support programs is really important. And so we do try to do that. I would say our pharmacy program has been a program that has been really widely accepted and embraced in our organization. At our organization right now, we have 11 sites, and so we have a lot of sites involved, which means that our impact gets to spread widely. So that's kind of exciting. from our point of view. Next slide. So I am going to talk about our pharmacy program. And it was a partnership that was begun with West Virginia University Extension Service and Chester Hill Produce Auction. We began our program 4 years ago, and it was focused on diabetes education at the time. It has since evolved. The program is relatively similar to what it was when it started, but as funding changes, kind of some of the focuses of the program adjust. It's kind of nice. It keeps the education fresh and different for our patients. But you do have to recognize that for those programs that have ongoing expenses, we might have to change some of the focuses as we change our funding. So next slide. All right, for our program that we ran through Marshall, the qualifications for patients were patients at risk for diabetes and hypertension. So we do try to look at that from a broad interpretation. And they needed to be low income or live in a rural community, or disabled or belong to minority groups. So all of our sites serve rural communities, so that's a pretty easy one usually to be able to check off. This is really a pretty inclusive program. You know, so they need to be at risk and they need one of these other ones. We find it's very easy to include almost all of our patients. As we've gotten additional funding, like this year's funding, we still have these requirements, but this year they can't have previously had hypertension, stroke, or cancer. So, you know, so some of those, again, it's tied to funding. Next slide. So we have service sites we had 4 service sites last year, and the patients needed to pick up their food during the weekly deliveries. Since COVID hit 2 years ago, what we have done is we've worked with Rural Action, and Rural Action is a produce, they have a produce auction in the region. They're actually located in Athens, Ohio. We live in a border county, but they partner with farmers and producers all over our region. So a lot of the food actually does come from our farmers. And we always engage our farmers when we need additional food. So like this year, our pharmacy program is going to be in 6 counties. And like I'm reaching out to the farmers now to say, hey, can you please get in touch with Rural Action? Rural Action helps coordinate it all. And what we have done is our participants qualify for their buyers club. If you live in a larger area, or, you know, if you're familiar with the co-op, you know, format, like the buyers club, you pay a flat rate each week, and then you get a specific amount of food. So we have been paying $10 for half a peck of food. I don't remember if I included a picture of how much food is in these bags, but there is a lot of produce. So half a peck is a lot, and they tend to fill it up as much as possible. So in a week, I mean, I know last year we had a week where they got green beans. They each got at least 4 ears of corn, and they had a cantaloupe. They usually will have a pepper or 2, an onion or 2, you know, so it's a lot of produce that families get. And it's been kind of nice as we've partnered with West Virginia University Extension Service, because we have people saying it's too much food, and they can talk about canning. And we have had participants begin canning because of the amount of food. We learned after our first year partnering with Rural Action that during the first session, we focus on freezing produce so that if a family gets too much, they can freeze it. But generally, our participants always say that all of the food has been eaten, or very rarely do they throw it out. And I actually had a guy he was single, and he said, you know, typically I'd be one of those participants where this just rotted at home, but because you give us education, we give them recipes that they can use. And then we follow up with them the next week to see how they use it. He's like, I've really been doing a good job of getting it. And then he shared it with his neighbor. And so often, you know, the impact is never just one person in this type of program. It is a family, it may be a neighborhood, it may be an extended family that also gets the impact. So always remember that when you're thinking about sustainability, that you're investing not just in one person, often you're investing in a group of people. In our rural communities, I'm sure if you guys work in rural communities, it's likely similar in your communities, but our people share and they're very generous and they're very open. So, and then we offer the class. So this was our first year actually using Rural Action, but last year we offered an education class at the time of the produce, when they got the produce. So next slide. We want to make this very accessible in our community. So we had the first year done it at the clinic site. Unfortunately, with COVID and some of the difficulties and offering the classes, as we added the classes where they actually have at least a 30-minute class that goes along with the produce that they're receiving, we needed to find locations that were a little bit more accessible. So we moved our sites to places that had large gathering areas. So Jackson County Fairgrounds is where we go in Jackson County. South Parkersburg Baptist Church and Elizabeth Baptist Church are two larger churches in those counties. And then I don't have here listed, but we actually last year piloted with our Marshall grant. We piloted working with local organizations. So Star Plastic and Constellium were partners, and we actually delivered the produce to their sites, and then we offered a Zoom class. So, you know, to try to impact individuals who do work and can't get away during the day to pick up. We're going to continue that model this year. So we're excited about that, you know, a different way to think about reaching people. And then anytime we have excess produce, so if somebody doesn't show up, what we've done, and this is amazing, and this is one of the things I absolutely love about just our teams because they're so phenomenal at coming up with great ideas. When we have excess food in Wirt County, we partnered with the senior center. So any extra bags went to the senior centers and were distributed through it when we were done with our programs at the end of that day. In Wood County, we partnered with, oh gosh, what's the name of it? It's Meals on Wheels, the program that does Meals on Wheels. And fresh produce is really rare for that particular program. So they were super excited, and then they would incorporate it into their meals if they needed to, or they would provide it to their food pantry. In Jackson County, we were able to partner with a drop-in recovery center. And so they got our excess food. And this year, we're trying to figure out a way to get that drop-in center to be able to transport its participants back to Jackson County Fairgrounds, because we want them to get the education. They got the education in the bags, like they got printed materials and stuff, but we really want them to have that instructor education. So, you know, partnering with some of those organizations is really nice. It's a nice way to just continue your impact with your excess. You know, we can't control who all shows up, but we can control that when it's, you know, even the stuff that is extra is getting to people who have great need. We had a site in Jackson County that it's one of the subsidized housing centers. So we had a champion at that site who delivered bags to families who were disabled and unable to get out. So again, they were able to get the information. We offered them the Zoom class. Honestly, they didn't attend well in the Zoom class, but they did get all the information, and we did get feedback from them. A lot of them would call the clinic and say, hey, thank you so much. I love this program. You know, and our hypertension materials this year really made an impact because they were very easy to understand. And I'll talk about them in a second, but they actually gave feedback that they understood things that they had never understood before. So that was really neat to see just the ongoing impact. Next slide. So our process is we do identify the patients both within the clinic and from the Marshall Grant, we opened it to the public. So this year, as we continue this program, we're opening it further and further into the community. We're going to try to get flyers out through backpack programs, through the local food banks, really try to engage the populations that we know need access to food and who also need linkages to healthcare, because we provide health screenings during our program. We want to catch those, those chronic diseases early, and we want to engage people in primary care. So that's the clinic community linkage that we're really trying to enhance. There is a pre-survey registration process, and they participate, and we do exit surveys. During the pre-survey and the exit survey, we have kind of like it's a health screening day, so that we can track their health screening. For patients, if they're currently a patient of the clinic, we have tracked that in our EHR so that we can start to look at some of the longitudinal impact. I will tell you that sometimes the longitudinal impact is discouraging, but occasionally you'll see some bright things. I know in Wirt County, 2 years ago, we saw sustained weight loss, and it continued. It continued for at least a year. I haven't looked back at the data yet. So that's exciting, that we have some sustained weight loss. The A1Cs improved, but unfortunately during COVID, a lot of those went back to higher numbers. So next slide. With the additional funding that Marshall provided, we wanted to do something in the summer or in the winter, in the fall and winter. So we asked for additional funds to do heart healthy cooking classes. The funds were used to purchase kitchen kits. So you'll see here this is kind of a kitchen kit. We bought knives and cutting boards, bowls, and then these are like the convection cooktop cookers. We also bought pots and pans. So community members could come in. They were cooking a meal that would serve a family of 4. And we offered these in 6 counties. We may have offered 7 of them. I think we offered 6 of them. Gilmer, Calhoun, Doddridge, Wood, and Jackson counties. The class was 6 weeks long, and it was based on the American Heart Association's Heart Healthy Cooking curriculum. American Heart Association has discontinued using that curriculum, and they gave WVU Extension Service the ability to utilize it. So we were able to shorten it to a 6-week curriculum. It's a 10-week curriculum, I believe, normally. We included information about hypertension and blood pressure monitoring. Oh, at both of the programs, the pharmacy and through this one, we coupled it with self-monitoring blood pressure curriculum, because we wanted to increase self-monitoring blood pressure. That's been phenomenal. I think that coupling some of your projects like that, it works really well. It allows you to provide extra access and extra resources to patients who are engaging already in an activity. So again, that sustained engagement. So this was a very successful class. We were able to get about 6 regular people at each of the classes. COVID impacted our reach this year. Unfortunately, we have partnered. I didn't mention this with the pharmacy, but this year's pharmacy was the first year we partnered with the Recovery Center in Wirt County. And our recovery community has turned out to be phenomenal students. They're very interested and they're very engaged. And but COVID hit our recovery centers really hard this year. So in Wirt County, some of our students, they had a long period of isolation because they kept bringing it in or being exposed. And I know that happened in Wood County too. So some of the limitations of COVID. Next slide. We have produced this resource to just, it's another way to engage patients. This is a Heart Healthy Life contract, and we used it with our pharmacy program, and the extension services used it, and we're going to use it with some of their other programs. It's just a resource to help create healthy goals for participants. So, when we talked about in the beginning, it's really hard to know where to start, and it's really difficult to know how to start. This is a simple way to look at, like, hey, what kind of impact am I going to want to make from this program? And so it might be eating 2 vegetables per day if they only eat 1. I mean, our goal is 5, but that may not be a smart goal for them because that may not be sustainable. So we use this as a resource, and this is available on Move More MOV, which I'll show you here in a little bit. I did want to kind of let you know, like, this is what we do, and we use it just to make an agreement and a check back point. Any questions so far? Sorry.
I have a question, Sarah. You said that you work with 2 businesses to serve as pickup locations for pharmacy.
Yes.
Is that correct?
Yes.
Okay.
Yeah. And
Great.
they're like, they're like plants. Like Star Plastics is a really large plant. And it was really neat actually this year when we partnered with them. Then as I show you Move More, one of the things that their HR person said was, I have 32-year-old males who will never go to the doctor, but if you come here and you do their blood pressure, they'll participate because they don't want to be rude to you. So, think about that when you're creating programs. Next slide. Oh, here's our self-monitoring blood pressure program. So with Marshall Funds, we have this available at all of our, we did it at the Heart Healthy, we did it at the pharmacy, and then we also developed a blood pressure cuff loaner program. We had started it at some of our sites, so we were able to expand it. And now each of our sites has blood pressure cuffs, and they loan them out. And we typically, depending on the site, like I have a site that's really active right now, which means they have a provider that remembers to loan them out. And so last time I checked, like all of theirs were loaned out. One of the challenges with blood pressure cuff loaner programs, just in case you ever decide to launch one, is we've had it, and I know I've spoken with other people who have the problem, is sometimes they don't come back. But it's just one of those challenges. For our pharmacy grant this year, we secured a HRSA funded grant, and we're going to be able to provide the blood pressure cuff for all of the participants. So that's exciting. They'll have their own. So. All right, next slide. This is a resource that I always promote. It's called carekit.com. And it is phenomenal educational material. I think I've done a presentation. Well, I know I don't know if it's the same group. I have done a presentation on carekit.com before. It is written at a third to fifth grade level. It's very simple. It uses lots of pictures, and it's written from a patient perspective, not a medical perspective, which is the biggest difference between this curriculum and every other curriculum I've ever looked at. And their blood pressure stuff that we use, it was exciting to see how patients engage with it, because it talked about, like, it has 3 main goals in their curriculum, and one is like, you want to have stretchy arteries, you don't want clogs, and what's the other one? You need to keep the blood flowing or something like that. So, like, it talks about healthy diet, it talks about exercise, it promotes all of the things that we want to promote, but it just does it in such a simple fashion that it's really easy to understand. And I would recommend it for any type of health program. Check out carekit.com. It was $2,500, I think, for the year to subscribe to their electronic version so you can print it yourself. And we did that for our consortium. So all of our consortium members can access it, which is phenomenal. And actually, I was just on a call the other day, and we're talking about doing a healthcare fair, and the CEO from Ritchie Regional was like, hey, we can use some of that CareKit stuff, right? And I was like, yes, absolutely. It is so easy to understand, and I just can't sing their praises enough. I totally recommend them. Next slide. when we talk about sustainability, I always try to encourage people to think outside the box of just money as being things that are sustainable. Our kitchen kits that we purchased 10 for each county, and they're continuing to be used for lots of classes. It's really cool. They're going to be used for more cooking classes. Actually, we have cooking classes going on this spring. One of my counties isn't able to get in a cooking class right now, but they're planning on doing another one in the fall. I spoke with a lady today who was taking her kitchen kits to Career Connection because she was going to do cooking with the kids. And then our 4-H camps plan on using the kitchen kit for some of their programs. So that's a lot of sustainability. It's going all over the place and it's still being used. SMBP curriculum continues to be used, and it's added to other educational opportunities. We have the cuffs now. So, extension services can set up a self-monitoring blood pressure station. To have a self-monitoring blood pressure station, you just need to have access to the blood pressure cuff. The person is doing it themselves, So I like to put out like signs about like what they should look for. CareKit.com has a wonderful, it's like a green light, yellow light, red light form, and it just says, hey, if your blood pressure is right here, you're good. If your blood pressure is right here, you want to contact your doctor and let them know, just, and they can follow up on it. And then if your blood pressure is right here, you need to go to the doctor, or you need to go to the hospital. So it's really simple and easy to understand. We found additional grant funding. So because we had some data on the pharmacy program, we have been able to seek other funding. So anytime you have a program, build on the program that you have. Like I said, ours started out as a diabetic program. Now it's going to be looking at hypertension prevention, stroke prevention, and cancer prevention. So just a great way to think about funding. Blood pressure cuffs, self-monitoring stations can be set up at any community outreach events. Every time I go anywhere, I grab a couple of cuffs and I just put them out. I mean, people can always check their blood pressure, and it's just a simple way to provide access. Remember, that piece is providing access. And then we have the blood pressure cuff loaning program, and that continues. And so I actually am probably going to have to purchase some more cuffs because I know one of our sites has lost 5 of them, but they use it the most. They loan it out the most. So I'm always happy to replace theirs because they're using it. All right, next slide.
Sarah, there's a question in the chat box from Dana. She wants to know, can you share the BP red light handout?
Yes, I will send it to Regina when this is done, and she can send it out. So.
Thank you.
Pressure chart. Okay, I made myself a note. We do a t-shirt contest to just help support the program. It won't completely sustain the program, but it's a great activity and it increases awareness too. So we've done this t-shirt contest fundraiser now for 2 years, and I need to get it launched and out the door right now because this is the time to get it out. We ask local high schools to produce a t-shirt design, and then we use one of their designs. And then last year we sold it online. I cannot think the name of the place. That was much easier. We didn't have to produce them in bulk. People could buy directly and have them shipped to their house. So I can look and see who that was. Bonfire, I think, was the name of it. So, if you do want to do something like that, and I serve a lot of counties, I serve a lot of organizations, and the first year I had bulk t-shirts printed up, and then I had to deal with money, I had to deal with deliveries. If you don't want to have to do that, Bonfire does that all for you. The t-shirts, I mean, you make a little bit less money, but it still promotes the program, and I think it's a fun activity. Next slide. So things to consider when you're thinking about what you guys can do. Think about what your purpose is, really have that kind of defined. Look for partnerships. I have partners everywhere. I never do anything alone. We have a lot of people already working on a lot of the efforts that we're already working on. And I tell everybody, this is not a Shark Tank. If I get money and I get resources, I will share them. And I assume that when you get resources, you're going to share them too, because we live in tiny communities. It's crazy for us to not share. And so always look at what your current resources are. You probably have them already. I mean, you probably have some already. You know, we have people who are working on food security. We have people who are working on health education. And so let's partner together and make it better. Let's not eat each other's lunches. So next slide. Really consider doing asset mapping. You know, who's already interested in the community, who are the helpers in our community, what's been done previously, what works and what doesn't work, what has been forgotten or lost in the shuffle. A lot of times, stuff getting lost in the shuffle happens. Maybe Susie was your phenomenal nurse practitioner who did all kinds of stuff for years and years, and Susie retired. You know, Susie invested a lot of effort and time into it. Let's try to find what she did. Let's try to, you know, use what's already been done. And I love this quote: if I've seen a little further, it's by standing on the shoulders of giants, because that's really what I feel like I do. I do not create any of this by myself. I see other great ideas and I apply them in our communities, and I share my ideas so that you can apply them in your communities. Next slide. So I want to just kind of transition, we still have a little bit of time, to just some other programs that we offer at Coplin that we've funded and worked with. And the next one is an exercise program. You know, when we started, we have funded and purchased some exercise parks in the communities that we serve in through grant funds. And when I was trying to engage our providers in using those and recommending those to patients, one of them asked, well, how am I supposed to engage my patients who don't live near the resources? So next slide. So that really fueled the motivation for this next project that we worked on, which was, it's called Move More MOV. You can visit it online. It's movemoremov.com. And when we asset mapped, we had a lot of assets in our region, and Move More is just a way to get that information out there. It's a very dynamic and easy to use website. If you go to it, you'll see that it lists parks in, I think 10 counties are what we have listed there. So parks, activities or activities that might be paid, they might have some type of cost related. Sports, we tried to highlight all the sports opportunities that we could see. Of course, not all of those are free in our community either, but the resource of the parks was the first one. And then, because we wanted to make sure everybody could have access, and we found parks and things to do in all of our communities. We didn't have a single county that didn't have anything. And then we also wanted to highlight other community resources that people had available. So if we have a chance at the end, we can maybe pop it up on the screen and you guys can see it. But this has really become a dynamic resource. We're actually working with the health department right now. We're looking at making this healthy MOV and including food access resources on it. I've already added substance use treatment and recovery resources to it. So, you know, we just wanted to have that one-stop shop where somebody could go and they could get access to resources for our region. We have a lot of great statewide things that you can sort and filter, but sometimes it's nice to own something nearer to home where they can call up and they might know the person on the other end and ask the questions, you know. So next slide. These community resources are on the Move More MOV. So if you want to get a copy of the Healthy Lifestyles contract, it is available on there for download. And then through, you know, as we started Move More MOV, we wanted to get people engaged with the website, and this really cool thing kind of progressed out of it. So we had some radio spots using some of the funding that we got, and we wanted to do some community wellness challenges. So in October 2021, I believe that was our first community wellness challenge. And I told you Star Plastics had partnered with us for the pharmacy. Well, after the pharmacy, they reached out to me and they're like, we want to continue to do stuff with you guys. What else can we do? What's next? So I said, well, let's do a community walking challenge. And that was our first one. Since then, I believe I have 8 community walking challenges that we've done. We are finishing up one right now. We were able to purchase a really giant and obnoxiously large trophy that goes to the organization who wins for the month. Westbrook Health Systems has it right now. Right now, in our current competition, we have 9 organizations walking. And last time I checked, which was a couple of weeks ago, we had already walked 15 million steps. And so, yeah, so this has been, I think this was an 8-week challenge. So that work at health, engaging people in their workplace is something that's working for us when we talk about exercise. You know, a lot of our organizations, our healthcare organizations, they don't have the capacity to add a lot of new stuff right now. And so when we talk about getting healthy, you do have to have the capacity to be able to make the change, but step challenges seem to work for us. And so we're going to continue to do those. We're about to launch one that'll start April 4th. It is in preparation for our Dash for Diabetes that the Coplin Health Systems offers each year. And so it'll be an 8-week Let's Get Ready to Dash challenge. The top 3, anyone who manages to walk 5K in a day, which is close to that 10,000 mark. For our current challenge and for the next challenge, they get entered into a drawing for a Fitbit charge. So that does have a cost to it. We'll pay about $100 for that charge. But it's just kind of a drawing for anybody who reaches that level, just to kind of engage them at the individual level and then at the organizational level. So that's a pretty cool result of, you know, some of the stuff that we've done. Next slide. Other programs that we have, we did get a HRSA grant to do the pharmacy, to continue the pharmacy. We continue to work on Move More MOV, and we have the Cuff Learner program. Next slide. We also participate in Reach Out and Read. So Reach Out and Read is a program that provides books to children who, during their wellness visit. And this is a prevention and an education program. So it helps teach parents or guardians how to engage their young people with reading. We see a lot of delays in children under 5 in reading, and it's because they're not being engaged in reading at home. So when they come to their wellness visit, they get a free book, and the provider can talk to them, can talk to their caregiver a little bit about how you would read a book with a kid, how you engage the kid, and they can demonstrate it. So a lot of times I've been in with like our pediatrician, and she'll be like, hey, look at this book, you want to read? And, you know, she'll read a couple of pages with the kid, get the kid engaged, and then she can talk to the parent and say, hey, do you read with your kids frequently? You know, how, and if they say, well, no, they never want to sit down and read. Well, have you considered doing this, you know, or have you considered doing that? So it's kind of a neat program. We have an RCORE grant, which is a Rural Community Opioid Response Program. Ours is to develop outpatient programs for adolescents and transitional age youth, so 12 to 26. We're doing a lot of work with the schools on that grant and trying to increase screenings as well as provide opportunities for youth. We're providing, I'm working with Work County. We're about to do a resource fair for the youth. We're doing like suicide prevention training, resilience training, coping skills training, that type of thing. It's a 4-year grant, so it's a pretty large grant. We have a colorectal screening grant where we educate patients about the importance of colorectal screenings. We actually have 2 grants. One provides FIT tests for individuals who can't afford it, and another is a partnership with West Virginia University Cancer Research, maybe, and they provide Cologuard to uninsured individuals. And we're looking at one with Gilead, which will help cover the cost of HIV, HCV, and HBV screening. So just some other patient programs that we're looking at. Next slide. That might be the last one. All right. So that's just kind of a little bit of information about what we do and how we do it and why we do it. And I am happy to field any questions. And Regina, if you want, you might pop over to move more MOV just so they can see it.
Okay, we'll just open the floor up while I pull up the website. Or unless you want to do it, is your laptop working?
My laptop is working. Okay, let's see. Oh, actually, yeah, that's great. I will see if I can share my screen here. So I actually was on the, right now what you're seeing is carekit.com. And let me go to cardiac and you'll be able to see the blood pressure control zone chart. So this is the zone chart. You can see it's very easy. It's so nice and simple to utilize. And we personalized it with our phone numbers here. While I'm here, I can pop over and just show you real quick the care guides so you can kind of get a feel for them. Here's like just the short idea on blood pressure. You know, it talks about a narrow pressure increases or narrow passage increases the pressure. So we want to keep our veins not narrow. We don't want stiff passages because that can increase the pressure, and then overload can increase the pressure. And they compare it to like a water hose. Very easy to understand. And so here's their goals. And then the rest of the curriculum kind of supports the goals. We want no overload, no stiffness, and no clogging. I love their exercise one. Let me see if I can, I think it's this one. Their exercise one is very practical. Did you have a question?
Yes, I have a question. Did you say there was was this a cost to this, right? It was like $2,500 or something?
Yes, it was $2,500, but we purchased it for our whole consortium, which actually has 14 health care centers. And so all of them have access to it. So that's been really, really nice.
Okay.
So when you look at the cost spread out, it really wasn't a lot. It's something that I thought, you know, like Marshall, you know, if you guys decided that you wanted to partner with them and shared to all your partners, like, you know, but you can just see that it's very different. It really approaches it from a patient perspective.
Right. And it gives you the whole portal. So you have access to all of those resources.
All of these. Mm-hmm. Yep. All of these. And each one has, you know, multiple guides. So this is like the guide for this one. And you can kind of do it by the site. Actually, I feel like we're going to be using, they have one, their weight management one is the one that we're going to use for our new program. It addresses hypertension and diabetes kind of together. So, and then weight obviously at the same time. This is our most popular handout, the Fast Food Advisor, because it recognizes that people aren't going to stop eating fast food. Again, it's like every healthy choice, but I can make a little bit healthier choice while I'm eating fast food. And then this one I think is really neat where it just shows the sodium. I have to watch my sodium. And so like it's amazing to see the amounts of sodium. So,
and is this a one-time cost? So the resources are updated, or do you have to pay for it every year?
I want to say it's an annual cost, but the resources are updated all the time. Like I mean, and as soon as they update them, you have access to it.
Okay.
So,
good to know.
Yeah, I really like it. I thought, like, man, could we just get like a statewide access? The more people who have access, because our population, I know, I used to do, I've done a lot of strategic planning throughout the state. You know, in a lot of our counties, only 1 out of 3 adults are reading at above a 4th grade level. And so we don't think about that when we provide curriculum, but it's really unrealistic to assume that most of our curriculum is being understood. It's not that it's not being provided, but is it being understood? This is Move More MOV. You can see it's bright. We tried to make it look as close to Appalachia as possible using somebody else's picture, but we thought that we did a pretty good job here. Under parks, we just have the counties, and then we listed all of the parks and walking trails available in the counties. You can see even Calhoun County here has several, and then each of these are linked to a page related to that resource, some type of resource, whatever we could find, you know, if they could see the trail or whatever. The activities are paid activities. Most counties did have paid activities also, a few. I was surprised at some of the counties, how many they had. You know, we think that we don't have resources, but we do. And then the workout tutorials were online things. This was done during the pandemic. The events, we usually list our walking challenges here. So if you would like to join the walking challenge, you can click on it and you can go to the website where the challenge is being hosted. And we use Challenge Runner to track those. And then here's our community resources. We tried to hit the ones that would link to the most resources. Here's the Healthy Habits contract if you would like to download it. And then we recently added recovery resources, and they're just all linked. So. Any questions about that? There was one more thing I thought, oh, I should show you that while we're on here.
Sarah,
Yes?
I have a question. These,
Yeah.
I was just putting it on the chat thing. The workout tutorials that you have on your move.com,
Yes?
movemoremob.com, are those YouTube files?
Yes.
Can they be shared to other entities? Or are
Yeah, they're just free resources that we identify.
Oops, you're muted.
Other resources. So, like this one is just, let's see, where to go? You know, it's just the station, the walking station on YouTube. Yeah, they can be shared.
Okay. Thank you.
And then this video actually, so I told you that we bought exercise parks. So this video actually was one of the things that our communities asked for. And Josh is a physical therapist that works through Mountain River Physical Therapy with our organization. And so he got on here and he showed how to use each of the machines. So we needed a place to be able to store it. So this is where it's at, so that, you know, they can see how to utilize it and proper training on what it does and what it's for. So.
I have a question.
Yes.
Back to those YouTube videos, you said that you found them. Where is the site those are available? We could just go directly there and share them on our social media.
If you just click on them, it takes you straight to the YouTube, and then you just copy the YouTube station. So I just linked them to the station, so that, you know, they could easily find one. But just click on them, and you'll be able to get to the
Click on
location.
them off of your website,
Yeah.
off of your site.
And then you'll
rather
just
than-
copy this address here.
Yeah. Okay. Thank you.
That's actually, while we have a little bit of time, Another resource that I've used a lot, and I know it was highlighted at another office hours, is Canva. And let me see if I can grab one. So our walking challenges we have on Move More MOV, a Facebook page. So we have a Facebook page linked, but I use Canva. I use Canva a lot to create social media engagement. It's very simple. I can, let me do a new one real quick. So if I just create a blank one, and I do this all the time, so I'm going to just put in exercise here, and it'll pull something up, and you just drag it over. And, you can kind of personalize this. You can just change the coloring. A lot of times when I go to my coloring, I'm with Coplin, so these are the colors that we use. It's super easy to adapt. I don't always change anything else. I just might change the color and put, a link to our site and just to encourage exercise. And so I know that's a resource that has been highlighted at another office hour. And then if I go over to Facebook, our Move More MOV, we try to keep it updated. I always update it at the beginning of a walking challenge. So we're in the middle of a walking challenge, and it posts just regularly, 3 days a week. I try to post to just share information. It's just education information. Depending on who you have sharing it, depends on your engagement. This moveitmonday.org is another great resource. I'll put that one in here. Move It Monday provides social media campaigns that are posted every Monday to a social media site. They give you what you will say here. They give you the link, they give you the picture, and you just kind of copy and paste it. I just added in our walking challenge information. So another great resource, and that's called Move It Monday. They have all kinds of campaigns that you would post every Monday. They have stress reduction, they have walking, they have Meatless Monday, so you can promote meatless eating or plant-based eating. Just a really neat resource. And then I'll go over to Challenge Runner real quick. Challenge Runner is the app that we use to track our exercise campaigns. There's a free version of it, so I utilize the free version of it, and people can log in with their smartwatch, and then you can see here's our leaderboard, and you can see these are all of our sites that are participating. It looks like I got somebody random here. I try to always link them back with their organization, and it tracks it for you. So another great resource. And then the nice thing about this resource is I can add all of our individuals up. I can export it to a spreadsheet and add them all up. And then I can promote that to people that I'm asking for funding for. And I can get feedback on who's walking, so. And they have pretty good chances, it looks like. Right now we only have 7 that are qualified to get the Fitbit, so. All right. Any other questions? Well, thank you guys for the opportunity to present. I hope that you guys got access to some new resources that you didn't have previously. I'm always available if you need to know what a resource is called or where it's at, or if you need ideas about funding for resources. Feel free to reach out to me. I can try to help. I work a lot with consortiums. I always try to do things for all of our partners. And when we look at purchasing resources as frequently as possible, I ask if they can be available to all of our partners. So the Mid-Ohio Valley Rural Health Alliance is our large consortium for healthcare sites, and we just share the resources. So it's very cost effective.
We do have about 5 minutes left. Do we have any other questions? You can unmute yourself or you can type your question into the chat box. And Sarah always does an excellent job with sharing resources and giving additional information that could be replicated in similar counties throughout the Appalachian region. So thank you so much, Sarah.
You're welcome. Remember, we're a friendly coral reef, not a shark tank.
That's right. That's right. Any other questions? Anyone who wants to ask? You can unmute yourself and ask your question, or you can type it in the chat box. And if you want to share today's presentation with other people on your team or other organizations, it will be available on our YouTube page probably by Friday, so you can share that out with your team members.
Thank you.
You're welcome. Sheila, did you have anything else to add? Sierra?
Just a big thank you to everybody that joined us today. Appreciate it. Great presentation, Sarah, too.
Thank you.
Okay, silence means agreement. Yeah, y'all know how I do. You don't hear anything. I don't hear
Somebody
anything.
asked for my contact information. Let me put it in the chat.
Okay.
Hey, I have one quick question real fast. Sierra Lookabill, is she now with the Marshall team?
So I've been interning with them since
Oh, okay.
May of last year. So yeah, I help out with the office hours and the newsletters.
Okay. Welcome. Thank you.
Yeah, thank you.
And she does an excellent job too.
Oh, I didn't say that during my presentation, but you know, a great resource is student workers. we actually had a student help build our website for the Move More MOV. I had a student help build the asset map for that program. I had a student help me with that video. So like, you know, anytime I don't want to say they're cheap labor, they're just an expensive labor. $500 in a grant can go a long way with a student.
Yes, it's an exchange.
Yes.
Yeah. All right, well, we are going to wrap up today's office hour. And once again, thank you so much, Sarah, for that informative webinar on nutrition programs. You also covered fitness programs and a lot of other programs also, SMVP. So thank you so much. And we will see you all next month at our April office hours. Sheila, what's the topic for next month?
Oral health.
Oral health.
Yeah.
Gina Sharps.
Uh-huh.
Gina Sharp.
Oh, I love her.
You
All right,
all
see
have
you.
a- Go ahead, Sheila.
Oh, I finished.
Okay, well, thank you all. You have a good afternoon. Bye.